All right, everybody, it is time to get started here. It is, well, since this is a worldwide conference, it is whatever time it is in your time zone, top of the hour. My name is Max Fritz, and we're here to talk about Microsoft Teams in healthcare. Just because I don't have anybody here on with me on the producer side, if somebody would put in the Q&A just to verify that you can hear me and see my slides, that would be fantastic. I will go ahead and get us started. So welcome to the Microsoft 365 Virtual Marathon. If this is your first session you're joining for, welcome. If you have been with us the whole day and are going to continue staying with us, we're happy to have you here. We're going to be talking today about specifically Microsoft Teams in healthcare and some of the fantastic and new and awesome stuff that is there. So, oh, and I've got a few people who said they got me. Thank you very much. Appreciate everybody put it in the Q&A. Happy to see that people are there. Okay. So without further ado, we've got 50 minutes here. We'll get started. A little bit of housekeeping. While we weren't able to get together in person this year at the SharePoint conference, we are looking so much forward to next year, the Microsoft 365 Collaboration Conference. Not just a SharePoint conference, not just not just North America, not just it's Teams, SharePoint, Power Platform, all the amazing collaboration things together. So hopefully we can get out of this in one piece, and we will see each other in March of next year at the MGM Grand Resort in Las Vegas. Pending, us getting out of this pandemic. I will be answering your Q&A questions as much as I can as possible throughout. So please keep them coming. Somebody did ask me if this will be available online after. Yes, the slides will be available. They will be at the Virtual Marathon website that's in the bottom left-hand corner. I'm not sure about recording. We'll have to get back to you on that part, though. The next thing we got here is this entire online conference was a huge undertaking for the people who were doing it. Hundreds and hundreds of sessions and stuff to coordinate. We had some fantastic sponsors who helped make this happen, so please check them out. Check out their websites. There's a sponsors page on the website, and we want you to head over there. So moving along, I want to introduce myself. Let's get forward and moving here. So as I said before, my name is Max Fritz. I'm in Minneapolis, Minnesota, in the United States, and I work for Microsoft. I'm what's called a Teams technical specialist there, which is all about helping customers in healthcare find ways to use Teams in creative ways and ways that are going to properly affect their business, and specifically for healthcare, affect their patient outcomes, get their doctors in a situation where they're able to take care of patients and not worry about technology. I've been a part of this Office 365 community, speaking at events like this for almost 9 years now, and super happy to be here. But as I said before, let's get to the core of the content. I've been talking about Microsoft Teams in healthcare for a few years here now, but things are a little bit different today. We are still dealing with the novel coronavirus, COVID-19. It is still causing havoc for all sorts of people. It's a highly unfortunate situation, as I don't need to tell you. That's why we're here together virtually as opposed to being able to get together in person. But the healthcare industry, quite obviously, has been affected in a few different ways. One of those ways is dealing with this intense demand for healthcare services. Both in the sense of dealing with patients who have COVID, these ICU beds you keep hearing about in the news and things like that, the personal protective equipment that we're so low on, but also people like you and I who may not be sick with coronavirus, but may need to check out, may need to see a doctor about a rash or a surgery or anything that we normally would visit a doctor for. Not only do we not want to be going into the hospitals where there's a potential for us to get sick, but these hospital systems don't want us coming in either. That's not good for anybody. And so we're starting to see a lot of remote and virtual healthcare happening, telehealth, and the general consensus amongst all the people that I work with and industry wide is healthcare has changed and it's not going back. Just like every other industry that we talk about, of working from home has changed the finance industry and so on and so forth, and there's no going back. Then there's going to be that new normal that everybody's sick of hearing about, but the new normal in healthcare is going to be really interesting to see what happens. And so how does Teams play into what we can do in healthcare? Today isn't just all going to be about COVID response in healthcare, but it's a looming overarching topic that we do need to keep in mind. And with that being said, I wanted to share with you guys a 1.5-minute video, albeit it is a Microsoft ad, I will say that, but I'm not showing it to you to show you an advertisement. I'm showing it to you because this is one of the customers that I work with, St. Luke's University Health Network. And they've done some really incredible things for accelerating the care that they can deliver during this time using Teams. And it will give us a really good taste for what we're going to talk about moving forward. As opposed to giving you an agenda slide, we're really going to be diving into all the different things that they talk about in this video. So with that being said, let's take a look. Oops, actually, you know what? I did the classic mistake. I did not share system audio. One moment, you will see the sharing stop and restart. We'll include system audio this time. I hear there's no audio. I apologize about that. I will share with you the link to this video, but hopefully the subtitles help you for those English speakers. All right, I'm sorry that there was no audio for you there. We'll move along because we don't want to spend too much time troubleshooting that, but I will share with you in the Q&A here the link to this video if you'd like to watch this yourself, as well as a few other videos. But hopefully that gave you a little bit of a sense of what we're seeing in the healthcare industry as we move forward here. All right, so let's talk a little bit about nuts and bolts here. Microsoft Teams. Well, you're all using Microsoft Teams right now, so hopefully you have a little bit of an understanding of it. But the main things that I want to talk to you guys about are the core pillars of Teams and the different ways that these are going to be used from a healthcare perspective. So you already know Teams is the hub for teamwork. It's our chat-based workspace. It's got all sorts of fantastic features where we can chat with individuals, integrate third-party applications, things like that, one-to-one group chats, use it on desktop, mobile, all the wonderful things in there. But we've also got the deep collaboration, integrating with Office, integrating with SharePoint, the new Microsoft Lists platform, Power BI, the different components like that. And oftentimes in healthcare, we're just seeing simply that files are being shared in every single way possible, just like every other industry. and bringing those together where we're not doing version 2, version 3, final edition, final edition, final for sure this edition kind of a file thing. Bring those together in a collaborative workspace is going to be helpful for us. But some of the really cool things about Teams in healthcare are the customization that we can do to extend third-party applications into Teams and vice versa, Teams into third-party applications. For those who aren't deeply in the healthcare space, a huge presence of an application in every healthcare provider out there is what's called an EMR or EHR, electronic medical record systems or electronic health records. And that is the end-all be-all application that if I as a doctor have to choose one application that I need to use each day, it is my EMR, because that's where I'm entering all my patient information. That's the patient record store. We don't store it in a file cabinet anymore. That's all stored digitally. And so we have over 150 partners in the third-party app space within Microsoft Teams that are healthcare specific, including the most common EHR providers, whether it's Epic or Allscripts or Cerner in the United States and some of the international ones as well. And along with that, when we talk about integrating patient data and all these healthcare specific things, we need to mention at least that this comes with the enterprise grade security and compliance that you'd expect from any Microsoft product. So Teams overview out of the way, let's talk a little bit about what we need to get past here. What is the current state in healthcare that's causing us such problems? What is Teams going to actually help us solve? So, current state, our disempowered clinicians. We're careful to distinguish between what we call team-based care, which is a defined interdisciplinary team that works together, example, maybe an inpatient ward, and a patient's care team, which is all the different providers you see as a patient. So team-based care is, it's a defined team, and a patient's care team could be people from all different areas of the hospital system. So with that in mind, we have unprecedented amounts of data on patients and capabilities and the diagnosis and treatment. But the true irony here is that we also have an unprecedented level of burnout. The shift to multidisciplinary patient-centered care is happening across the board, and patients now have an average of 6 times larger teams of providers trying to take care of them. So we're relying on these teams of experts while you're in a hospital, for example, to coordinate across the care continuum. For example, I, as a patient, Max, need to be taken care of by these 6, 7, 12 different providers, and they need to share information about me. And all of this information exists. We have a proliferation of data, but it's just not happening. I have to re-explain myself each time I talk to the next doctor. If you haven't experienced that, you've definitely experienced it when you've called into a customer service line. You get escalated to the next person. You have to re-explain your story all over again. Even more maddening when you're a patient in a hospital. And so if we want to leverage these insights from patient data, we actually need care teams as providers, as doctors, to be able to access the right information and coordinate with the right people at the right time. Yet we actually have seen that according to NAP in the US, $130 billion is lost yearly due to inefficiencies specifically around patient coordination. We're also seeing increased specialization, things like that are making things more complex. More specialists are needed, more interdisciplinary things. And on top of all of this, that entire situation, we've seen all of this evolve over the past 5-10 years, but we have not seen care collaboration tools evolve. We have not seen new technologies pop up. We're seeing old school instant messaging, email, file shares, things that are frustrating the providers and really hindering true care to the patients. And clinicians facing these real-time care decisions, and please don't get me wrong, I don't blame them for this, but they often rely on an unsecure workaround to communicate with other providers. If my communication tools as a doctor to communicate with one of my other fellow colleagues who's a specialist in a specific area are lacking or slow or unreliable, and a patient's life is on the line, which is an all too real occurrence, Am I going to use the unreliable or slow tool? Or am I going to send a WhatsApp message? Or am I going to send a text message? One of these things that is A, non-compliant with patient data in pretty much every major country in the world, and B, just isn't secure. So how do we find a way to bring those together to get us out of those ways, and then getting ourselves out of our fragmented systems? So let's talk about fragmented systems for a moment here. So when it comes to fragmented systems, we have all sorts of different healthcare systems. We have the devices that you're hooked up to if you're in a bed in a hospital. We have your electronic medical record system. We have email, we have chat, we have analytics dashboards. We have all these different things that are just all over the board. And there's solutions, we call them solutions, but they're just fragmented systems that actually impede interoperability of patient data. So physicians are actually asked to use 7 different applications. They might go to one tool for the record, another tool to schedule what's going on, another tool to look up the drugs and the side effects they might be prescribing. It's just a problem across the board, and it increases these risks to us and increases compliancy issues. And then last but not least, we have got inefficiencies left and right in the healthcare system. We have complexities in reimbursement claims. We've got weak handoffs between individuals that are taking care of a specific patient. These clinician burnout rates, which are due to the amount of tools they have to use and the inefficiency of these tools, are causing increased costs for us for talent. And so all of this is just compounding and compounding. And if you're in the United States, this problem is worse than most other countries due to the healthcare system in the United States. Take it for what it is, not making a comment whether it's good or bad in privatized healthcare. It is what it is. But all of the things like reimbursement claims, those all make it harder for us and our clinicians to deliver the care they need. And so how do we help? How can we actually get around this? Well, today clinicians come to work hopefully endeavoring to deliver the best care for their patients, despite the system they're using. You maybe as a hospital administrator want to turn everything on its head and make the system work for the clinicians. And at Microsoft, we know that clinicians need to work together as a team to deliver safe, high quality, compassionate care. And to do that effectively, those clinicians need a seamless technology experience. And so here's where we come back to teams. We come back to talking about finding the right system that's going to save time and money and improve patient outcomes. So finding one application that can combine everything into one, be a single context. If you're using Teams in your organization right now and you're not in healthcare, you know the fantastic things it can do of bringing together the files you're working on, the meetings that you're a part of, the applications you use, whether they're first party or third party or things like that. It's a huge thing. And this isn't just about reducing our bottom line. This is about patients feeling that their care team is communicating effectively. Again, back to that example, when I as a patient know that when I'm being handled by Dr. John and then I get handed off to Dr. Sally, that they are sharing the information properly, that's a better feeling than if Dr. Sally asks me a question that I know I told Dr. John. If I get that feeling that Dr. Sally doesn't know the answer to that question, what if she doesn't know about the medication Dr. John prescribed me? That is not a good feeling for me as a patient. And so we want to improve that patient experience. And we also want clinicians to spend less time with technology. I know it's ironic, I work at Microsoft and I'm saying spend less time with technology. I take it as a win. If my clinicians, if my customers are using less time with Teams than they are spending time with their patients, because that's who they should be in front of, with the patients. So how can Microsoft Teams help us face this? Well, top of mind for healthcare leaders, core things, we need to help with care team collaboration. We need to improve handoffs, integrate our systems, and earn patient trust. And so the ways that we're going to do that with teams, and I promise we're going to start talking about some cool solutions here. I know this has been very kind of markety, but it's really, I truly feel passionate about this. We're going to really hit each of these on the head with the different ways that the Microsoft Teams can help with this. From the communication side, you all know Microsoft Teams is a great communication tool, but did you know that the end-to-end and at-rest and in-transit encryption that's included in Microsoft Teams is fully compliant with every major healthcare regulation that is out there, US and internationally. In the US, fully compliant with HIPAA. You can use Microsoft Teams to communicate about your patients. Encrypted messages both within your healthcare system and to other healthcare systems. So now your healthcare team can actually follow its understandable desire for quick, efficient communication. They can and make sure they're staying in line with these privacy and security rules. There's no need to go to WhatsApp or send a quick text message because I've got the app on my phone that's going to let me do it as is. From a collaboration perspective, oops, I moved too fast there. Excuse me. From a collaboration perspective, we are bringing together these clinicians that are overwhelmed with their clerical duties from the fragmented tools and systems, and we're bringing everything together in a single context in Teams through single teams to improve the handoffs, to integrate with the EMR, all those things. We're going to customize and extend by integrating with the EMR, by integrating with third-party sources, by bringing patient connection tools like bots and templates together. And then obviously the first and foremost, last not least, the enterprise grade security and compliance. So let's look at what things could look like for a specific healthcare professional. So often today, clinicians are using those unsanctioned apps, but we can actually have a collaborative conversation in our admissions team or in the admissions channel to talk about a patient and share everything with everybody. Go into our one-to-many chats, go into our one-to-one chats where we can do all of this secure messaging within the same place. It's easy for me to do. I can do things like set message priority. Everybody's heard about this message priority where we can set urgent messages. Great for healthcare when I really need to get a hold of somebody, far better than a text message. Diving deeper into my notifications, diving into all of these things using one application. Everything that we're seeing right now, so far, to do all of this in an old school healthcare system, we're using 4 different applications so far. We joined that weekly meeting, we're using 5 different applications. We post an announcement, we're using a 6th application. Putting this all in a single context where my provider doesn't have to have all these apps open is going to help us incredibly. So let's talk about some of the challenges and some of the ways we're going to solve them through Teams, both based on built-in features that you probably have seen before and some cool stuff that we can do afterwards. So challenge number 1, care teams need an easy way to collaborate, right information at the right time. Solution, we're going to use encrypted messaging, voice and video calling, and meetings. Pretty simple here. Clinicians can send encrypted messages to connect on patient health securely, limit the compliance risk, no consumer chat applications. You can follow what's going on through our threaded messages. So we're really talking about core basic stuff in here. Talk about our patients in one-to-one chat or persistent channel conversations. Or even if we don't want to talk about the patients, just get a hold of somebody. Escalate to this full-blown meetings of audio and video to share notes in real time. This is a huge deal right now with COVID, with our care teams who might be able to physically get together in person on a normal basis, but who are all stuck maybe at home, or maybe they're just 7 different places at one time trying to take care of patients, being able to hop on a quick video conference to say, yep, I agree with that plan of action for this patient. Background blur and background replacement, I know they're fun, we love them, but it's really crucial in the healthcare space. If you have sensitive patient information behind you, maybe an x-ray, maybe a chart, anything like that, or even a patient behind you, that needs to be blurred. That is respecting their personal information and privacy, and that's a crucial component. Now, from our messaging side of the house, the house, we've got some really cool things that we can do that are healthcare specific, but also available to anybody. One of them is a smart camera. Not a lot of people realize this, but there is a camera icon in your Teams messaging on your mobile device. So if I'm in my Teams mobile app and I'm in a chat or a channel conversation, I can click the camera icon. Now here's what's really cool about that. If I snap a picture and send it, it does not store it on my local device. We are 100% staying compliant with storing everything in Teams and not on your local device. So if you need to take a picture, like in this example on the screen, a picture of a bruise, and send it off for a quick consult from one of your fellow providers, you can do that. And if you even want to annotate it with ink, that's also available. Want to answer a couple quick questions because a few people did ask them. Sorry, I have not been able to moderate the Q&A as well as I had hoped to, but the session will be shared after the slide deck, and I believe recordings might be shared as well. We'll have to follow up with you guys on that.
Yes, recordings will be available afterwards.
Thank you, Ryan. Awesome. Okay, a couple other awesome features in Teams that you've probably seen, but I want you to imagine them in the healthcare context. Those priority notifications, you know, those ones that we all heard about like 6 months ago, and we're like, oh God, no. Where it's every 2 minutes for up to 20 minutes will vibrate or ring your devices, mobile devices or desktop devices. When we're talking about ways to let providers communicate with each other in urgent scenarios, that is vital capability, and it can replace the old school pagers that we're seeing still in so many different healthcare systems. Message delegation of what if I send a priority notification or maybe a lower message to one of my colleagues asking for them to take a look at something. I don't realize they're out of the office or in a do not disturb scenario. Well, they can put in their status message, they can mention somebody else, and those messages, if they're priority, will automatically be rerouted to another person to help me out. And then federated messaging, unlike the days of Skype on-prem, where all of the data could be on servers in different places, because Teams is a Microsoft Cloud hosted service, if you want to have federated messaging between your provider organization and another one, you can do that, ensuring that there is end-to-end security between the two. Now, let's talk about some cool stuff that we can do here. We have got a brand new technology sitting on top of Microsoft Teams called virtual visits. It leverages what we call our booking service within Microsoft Teams and allows you to schedule, manage, and conduct telehealth visits for your patients, whether it's something like a surgery follow-up, maybe a COVID assessment before somebody needs to be seen in the hospital. Maybe some of you have been a part of some of these virtual visits, whether they're using Microsoft Teams or something else, where you're able to use your phone or your computer to converse with your provider. Well, let's show you how that works within Microsoft Teams. It's really quite cool. So I'm going to pop up my Microsoft Teams environment. And right here, I have the Bookings app. This is available to any organization as of last week with Office 365 E3 subscriptions or higher. All you need to go is go to the apps in Teams and search for Bookings. There's some setup process to get things set up, but we skip through that so I can show you some stuff right away today. So I'm signed in here, and let's say I'm a scheduler and I am taking care of scheduling appointments for my small group of clinicians or a larger group. I see all the clinicians I can schedule for here, and I can start making appointments. So I'm going to say I want to do a new booking for later this evening for Dr. Max Fritz. So we'll click on an empty spot here, and we're able to select what kind of a visit we want to do. These are fully customizable. We'll just say initial consult for now, and we put in some basic patient information. Not so much that we're putting patient information at risk, but enough that the doctor can identify who the patient is. So in here, I'm going to put John. We're going to put in my email address here and a phone number. Yes, this does support international phone numbers in addition to US-based phone numbers. We can additionally CC other email addresses that are not the patient, but maybe a patient caretaker, schedule when it's going to happen for, add additional providers if we need to, and add some internal notes. Patient is complaining of an abdominal persisted for 7+ days. I can customize some email reminders as well of what's going to get sent out, but let's just go ahead and schedule this. I'll hit send, it'll spin for a moment, and it will schedule the visit for us. You can see it's getting scheduled on both of those provider calendars like we had talked about. Now let's switch personas into the doctor. So let me change my window here, and let's sign in as the provider. The provider doesn't need that entire scheduling interface. They just need to see their calendar. And here we go. There's the initial consult for John. I'm signed in as Dr. Max Fritz here. I click on this and I can see the information. I can see that Dr. Judy is also invited to this. I can see it's an initial consult, some basic patient information, and those internal notes. But let's look at the other side. Let's look at what the patient sees. I got to pop open my email. I closed it to save some processing power for today. And I should have that email in no time here for us. So I get an email sent to me with an upcoming booking appointment. It shows my upcoming booking. It shows when it's happening. It shows who it's with and what time it is. Now it's showing join Skype meeting, which of course it is right now, a little bit of a failed demo. Apparently somebody in my tenant has been screwing with the settings, but that's okay. We'll come back to that if we have a moment. What we can do here is the provider will hit the join button and the patient will hit the join button as well. You know what, in fact, we have a couple extra minutes. Again, apologize for the demo issue. I'm going to show it in a different environment here, and we'll just do this real quick. Okay. You know what? We'll come back to this a little bit later. But the basic functionality is that this schedules a Teams meeting internally and sends the link to the patient. The link that's getting sent to the patient is a web join link so that that patient is able to join through here, but they're not included on the actual main invite. It's not sending them a true invite. It's just sending them a join link. So they're not part of the meeting chat. They're not going to see all of this information that's here. They're just being given the ability to join that meeting, whether it's from a mobile device or from a web browser or a desktop application, even if they'd like to. Consistent for me as a provider that I join this Teams meeting just like I would join any other Teams meeting. It's just sitting on my Outlook and Teams calendar, but my patient is able to pop in as well pretty easily. So it's a really cool new thing that you can use, and even if you're not in the healthcare space, Bookings is available to you to use for whatever you might need it for. We'll try to come back to that one and try that demo again if we have time near the end. Otherwise, I will make sure to show some, share some information for you on how that all works. In the future, and actually today, all of this is accessible through our Microsoft Graph API, which if you're not familiar with it, is the technology we can use to programmatically access this kind of stuff, meaning if you already have a way to schedule visits through your electronic medical record system, you can also add in those Teams virtual visits to your EMR through our API. So it's available for you to integrate into your electronic health record systems today. And we are working with the major EMR providers to make it even better. Oops, and I scrolled too fast again. Sorry about that, everybody. Okay, Let's talk about our next challenge here. And this is those fragmented tools that we talked about before. We don't need to dive too deep into this specific challenge, but how do we make our fragmented tool space actually and bring things together? How do we keep momentum going between teams that need to meet frequently? How do we enable huddle scenarios to happen between our providers? So in this scenario, we're going to help share ideas and manage initiatives across the organization, bring things into one single hub together. And a few different ways we do that. It's all about digitizing our health team huddles, the huddles that happen during shift change, the huddles that happen on a weekly basis that we talk about what needs to be done, how we need to improve care. We built a huddle bot in partnership with Avanade, where it's a chat bot available for you. You click into the chat bot and you are able to post ideas that are going to be used in your huddle for the next huddle that comes forward. Those chatbot items then actually go into Microsoft Planner, into a plan that's used by the huddle leadership to organize the agenda of the upcoming huddle, which then brings it into Power BI to show our effectiveness of getting things done throughout the huddles. Those huddles are then done through Microsoft Teams using Teams meetings in a really easy to use manner. Our next challenge that we're going to address here is improving handoffs. Patient handoffs, we talked about this a few times already. It's when Dr. Sally hands off a patient to Dr. Joe. And we oftentimes miss crucial information there, which really makes it so that our readmission rates, the patient actually being readmitted to the hospital or clinic, happens higher, and that the cost of us taking care of the patient is higher, both terrible for the hospital system and the patient. So how do we streamline this and make more informed diagnosis decisions, treatment decisions, and foster collaboration? And this is all going to be using our brand new Patients app with electronic health records integration. Let me show you what this looks like. So I'm going to go into one of my teams here. And I'm going to go into my tumor board team, and I'm going to click on Patients. And up here, it's going to load an app for me called the Patients app. Here, it shows me all of the patients, including their medical record number, their ID, their name, gender, birth date, things like that. And I click on a patient, and not only do we have that information, but hopefully this loads for me right now, I can see all of the information about them, the medications they're currently taking, their current vitals that are coming from their hospital room with their connected equipment, any details of their conditions, and any specific notes that we can collaborate on between the different providers, improving our handoffs. This is pretty cool. You know what makes it really cool? This is pulling all of this information from the electronic medical record system. And as you saw, it took a second to load. Let's open up a different patient here, because we're not storing this data in Teams at rest. We're not even bothering to do that. We're pulling it live from the electronic medical record system every single time it pulls up. Now I've got a fake EMR on the back end here with low processing power, which is why it's taking like 10 seconds to load every time I click something. But if you're using a real EMR, it loads like that. You pull up the patient, you pull up their information. Coming soon, we're actually also going to be able to mention the patient information as a card within one of our Teams channel conversations or chat messages. So if I need to send a message to Dr. Max saying, hey, Carol Allen needs some additional care, can you check on her? I can just @ Carol Allen. It's not going to send Carol a notification, but what it will do is put in a card that shows quick information about Carol. And I can add in additional patients from my EMR at any time. I can add patient and putting in their birth date. This is a really cool technology, soon to be based on the new Microsoft Lists platform. All sorts of awesome stuff coming here, and we really want you to try this out. If you go into the App Store and search for Patients, you, as a healthcare provider, you will be able to use this app today. Integrating with the EMR, admittedly, is a little bit more complexity, but feel free to reach out to me via email or Twitter for that. Okay, we got 10 minutes left, and I want to get through a lot more cool stuff. Next thing up is shifts. Shifts is so cool, but so basic. I can't even tell you the amount of nurses I have heard from that have their schedule in an Excel spreadsheet or on a whiteboard. And when they have to do shift swaps, they have to update it and re-email it out. Nobody's sure if they have the right version. There are really advanced scheduling tools out there like Kronos and other stuff like that. But Shifts is an easy to use scheduling application that'll take you from something like Excel and actually bring you to a situation where you can put in time off requests, you can do shift swaps, schedules can be published by a manager or unpublished, all sorts of amazing workflows and processes in there. I don't have too much time to show you that today, but it's so worth looking into as an easy win in the healthcare space. Now, I'm actually going to move on a little bit here in the interest of time, because I think there's some really cool stuff we can talk about when we talk about our situational response, specifically around COVID-19. Now, we've already talked about the Teams virtual visits, but to bring this a little bit further, that was that telehealth thing that I did that now you can remember I failed on demoing to you properly. But we saw that the prospective patient really just receives an email with a one-click join into the full video conference, and they remotely assess from the provider perspective. It's really cool the different things we can do there. In the slide deck, you're going to find some resources on how to set this up yourselves and how to start using this, including a webcast that some of my colleagues did. Now, the next one, this has been, honest to God, one of the most rewarding experiences of my career, probably the most rewarding experience of my career. I get the claim to fame to say that I actually helped build this solution with one of my healthcare customers. And this is called Teams Virtual Rounding. We're really trying to help keep our providers safe from infection and reduce the use of what we call personal protective equipment, things like gloves, masks, things like that. We now have over 25 health systems using this solution. And what it's all about is having a device. Maybe it's an iPad, an Android tablet, a Surface, some sort of easy to use device in a patient room that's locked into an ongoing private Microsoft Teams meeting. All the non-Teams meeting features are disabled on the room device, including chat and recording and anything that could put our patients at risk. And the providers are actually able to join these Teams meetings to virtually check in on their patients that are in a hospital room at any time. And I want to show you this because it's just pretty cool what we can do. So at the beginning of the day, or when a patient is admitted to the hospital, the nurse in the patient room walks up to the tablet and clicks on this button. The tablet's running Teams, it's locked into Teams, and we have just one power up there. They click this button, and this is going to try to launch a different window. Don't worry about that. It's because I'm using a web browser today, but we'd use the full Teams app on our iPad or Android, whatever that is. And this patient room just basically sits in the team at all times. Sits in this Teams meeting with video on and audio on. We can turn camera on or off as necessary for patient privacy. I did audio off just so that we don't get an echo effect here. But this is set up at the beginning of the day. Now, let's say I'm a provider, I'm a doctor, or maybe I'm a nurse. I go into my Teams application. I've got a button called Virtual Rounding. It's going to load up a Power App. And by the way, if you want to learn more about Power Apps and Teams, join me tomorrow. Awesome stuff coming. I choose the building that I need to. Let's say building 1, floor 1, room 101. And I click a join button. I click join. It tells me confirmation. Is this really the room that I want to enter? Yes. Let's click this again. Magic behind the curtain. It will launch in its own application, not in a new web browser. We'll just continue on the browser for now. I'm going to join with audio off. And now you can see that I can see the patient in here. The patient and I are able to converse and communicate with each other. In fact, you know what? Just to make this even, to put more proof in the pudding, let's turn on the camera for the patient. So there we go. I'm the doctor here looking at the patient. The patient, hi, I'm stuck in bed, but I'm doing okay today. I could use some more yogurt, whatever it might be. And then as a provider, I can hang up and move on to my next patient. And by doing that, I've saved myself from having to use a new mask, use new gloves. I've saved myself from the potential risk of becoming infected by a COVID patient. This is really cool stuff that's happening in the space right now. But let's take it one step further. What if my patient wants to check in with their family? I truly hope that none of you have family members that are in the hospital right now, but unfortunately, I imagine that at least somebody sitting here does. Well, what if our patients want to check in with their family members or vice versa? Well, we've got this great option to actually put in an external participant, to put in an email address of a family member and invite them to visit the patient as well. And we can control that, we can set time limits, all sorts of things to make sure that we're staying secure, but allowing the family member to come in. And yes, a lot of people who are in the hospital may have an iPhone or something like that where they can FaceTime or Google Hangout or whatever it might be using their own device. But we also have a lot of elderly patients that don't necessarily have that capability or aren't able to do that on their own. And this is providing us the ability to set this up for them. Super cool stuff that's happening there. Okay, let's keep moving on. Some resources for you again here for you. One of the last things I want to demo for you is the COVID-19 bot. This isn't specifically a Teams thing, but it's very related to Teams. Microsoft has a health bot platform where we can build all sorts of Q&A, health related things. It's based on the main Microsoft bot platform, but we actually partnered with the CDC in the United States to build a COVID assessment bot to help you as an individual determine, are you at risk for coronavirus? Let's open that up and look at what it looks like. I'm literally on the cdc.gov website on their symptoms of coronavirus. And if I hit self-checker, this is loading a Microsoft Health bot. This health bot has served, I don't remember the exact number, but we're over 10 million different requests at this point. So I can say where I am. I specify it a little bit further, specify the information about me. I go through all of this and it tells me of what specific risk I have. And we're constantly updating this with the CDC. And what's really cool is that this isn't only in use by the CDC, this is in use by providers across the world. We have hundreds, if not thousands of providers that are already using this. Providence in the Pacific Northwest of the United States is a coronavirus assessment tool. You guessed it. It's built on the Microsoft bot platform. You click on a coronavirus assessment and it launches and loads up. They named theirs Grace. Same thing though. We're able to pop in here and do our assessment. And what relates us to Teams is that we can actually, if we determine you're at high risk, we can take this health bot and actually queue you up to be taken by a live agent within Microsoft Teams at the provider organization. So Providence has a setup that if you answer that you're at high risk, you can click a button to immediately chat with a nurse or provider to get additional questions answered and figure out what you need to do next. So really cool stuff. Okay, there's going to be some resources in the slides here. A few last things I want to talk about in the couple minutes we have. We have an emergency data tracking app in Teams that leverages Power Apps and all sorts of things like that. So you can identify what beds are open, how often we're discharging, when we're low on equipment, because we're seeing things turn over so fast that the existing technology to manage our equipment doesn't update usually more than once a day, but we're running out of masks and things like that on an hourly basis. We've also got an emergency communications app. This can be used by healthcare and non-healthcare to send out a company broadcast to the entire organization saying, hey, here's what we're doing, here's what's up, here's what you need to know, emergency. Along those same lines, we have a crisis management application where you can share your status with your colleagues, you can make a request to leadership, you can view all of the information in one place about how your organization is dealing with coronavirus. And bringing that, a takeout of that is a full SharePoint site template that's available for you to use called a crisis management site. So we've got about 1 minute left, and I know we blasted through a lot of stuff there. Some next steps for you from the Microsoft perspective, we've got an ebook, we've got more about Teams and Microsoft 365, but let's talk about some awesome virtual conference stuff. Number one, you ready for a raffle? We're giving away 3 Oculus Quest all-in-ones. So visit the vendor booths, watch the videos, submit your answers, and you need at least 5 correct answers for the chance to win. We're going to give away 1 per region. We really would love for you to consider donating to the following charity relief funds: United Way and International Medical Corps. Please do that. We're actually donating a bunch of the sponsor funds to that as well. And lastly, please provide us some speaker feedback and event feedback at these links or QR codes. We would love to hear what you thought of today. There are more fantastic sessions going on for the next day. I will be up again tomorrow. Just utterly amazing content. An event of this scale has never been done before within Microsoft, and we're so excited that you are here to learn. So again, thank you for joining us. That's all I have for today. I'm going to go through the Q&A to make sure I haven't missed anything else.